Hello, my diet tribe. Welcome to another episode of Let's Talk Diabetes with Inkiruka. And today I'm going to be talking about diabetes, mental health, and stigma. So, how can we make this work? I repeat, how can we make this work, especially in the low medium income countries? I'm just happy to be talking about this topic. And this is the month of May. It's actually the mental health month. So it's good that I'm even talking about this just now. And I was very excited when mental health and stigma were focused on at the just concluded IDF Congress in Bangkok. So what I'm going to talk about today is just like key summary points that I garnered from the sessions that I attended at the just concluded IDF Congress. It will interest you to know that diabetes and mental health are like closely linked, and stigma can actually worsen the outcomes and prevent individuals from seeking help. So what we need is like a unified approach to make it work. So the first key point, the connection between diabetes and mental health. So people with diabetes are actually like more likely to experience conditions like depression, anxiety, and diabetes distress. These conditions can actually negatively affect blood sugar control and self-care management. So the second point is the burden of stigma. Stigma can come from our society, or it actually could be internalized. And this can lead to shame, isolation, and can discourage people from managing their health or seeking care. This is something that we see on the increase in the low medium income countries. It's really bad. And we need to find a way to help people out of the burden of stigma. The key point 3 is barriers to effective care. Care is often fragmented, and providers may lack the awareness. The financial barriers could also exist and impact on how well we manage ourselves. And this can actually prevent people from going out there to get the support that they need. So making it work now is we need integrated care. We need a team-based approach that includes both the physical, mental health, and this will provide much improved outcomes. So screening for mental health care is actually very important. So we need to start doing this at our healthcare centers, especially in the low medium income countries. We can pick this up quicker. Education and support. So persons living with diabetes need continuous education on how to better self-manage themselves, peer support groups, you have family involvement. All this kind of like enhances motivation and reduces stress. So how can we tackle stigma? Use very respectful language when you're interacting with people who live with diabetes, and you raise a lot of public awareness and train the healthcare professionals, especially in the low medium income countries, so that they will know how to speak to people and reduce stigma and encourage people to come out more out of their shells to seek for help. So policy and system change now. This is something that we really need to work on. We need access to care. This must be improved through like better insurance coverage, which is something that we lack in the low medium income countries. And we need strong health parity laws to help people, strong mental health parity laws to help. So what's the take-home message today? To improve outcomes, we must make a holistic approach. And a holistic approach, yes, towards managing mental health and diabetes, and actively fighting stigma at all levels. So stigma doesn't just come up at the societal level. Even us as individuals living with the disease, we stigmatize ourselves. We don't want to come out there and speak and let people know. We are afraid of what people might say, how people will perceive us if they know that we live with diabetes. Diabetes doesn't have to dictate the way you see yourself. You are more than the disease. The disease doesn't have to dictate how you live your life. You are more than diabetes. Let people around you know. From your advocacy, education, you can actually help other people who don't even know that they are living with the disease. So help starts from us, and we need to really work on our mental health by doing things that can distress us and make diabetes not seem like a chore. Remember, you like, subscribe, and hit that notification bell. And just before I forget, I had a brief conversation, or in my last video, where I asked a very important question about if diabetes was the bad guy. And from my support group, I got like, oh my goodness, everybody was like, diabetes is the bad guy, diabetes is the bad guy. So the main reason why I went ahead to make that video and pose that question was to assess where they were mentally with their diabetes self-care. And everyone looked at diabetes like, oh, this disease is so terrible, it's so debilitating. Oh yes, it can be debilitating, but it also depends on how you perceive the disease. So if you perceive the disease as being terrible, your self-care management will be more like a chore, and taking care of yourself will be like a burden, and you will not feel encouraged in any way to do better or better self-care, manage yourself. So guys, remember, like, subscribe, and you hit the notification bell so that you can receive more videos on Let's Talk Diabetes with Nkirika when they are uploaded. Thank you.